Okay, to sum up the affirmative side that I'm arguing for, which is the pro side of lowering the drinking. The alcohol in terms of health improves blood lipid profile and increases HDL cholesterol. It decreases LDL, bad cholesterol. Another point for that is alcohol decreases thrombosis, blood clotting, and reduces platelet aggregation. It also reduces fibrinogen, a blood clotter, and reduces blood pressure. So introducing it as terms of health at the beginning, or as you gradually develop, helps your health in terms of, I guess, your heart, because your heart is in terms of relationship to the blood. Now, for the accidents, in terms of accidents, I talked about earlier how binging could be the excessive drinking side of lowering the alcohol. But if you don't let it be a legal thing, then students or anyone who is trying to get alcohol around the ages of 18 and 20 will have trouble trying to get the alcohol, so they'll commit some type of crime. And from that crime is mostly getting a fake ID. One of the things about getting drunk is that, from Sean Flynn, who wrote "Should the Drinking Age Be Lowered" in August 12, 2007, drunkenness also spawns other problems, and assaults, rapes, and accidents and alcohol poisoning, both fatal and nearly so. Young adults who are drinking illegally are reluctant to summon help when things go wrong. If a student passes out, in the old days there was usually someone around to check, says Alan Mulrath, a psychology professor at University of Washington who helped develop a widely used alcohol screening program called BASICS. Now everyone's afraid of getting help. So when these students go binging, they don't want to call the police because they're afraid for themselves of getting into any trouble. So if we lower the drinking age, the probability of saving lives is also at risk, or also a factor. So just lowering it will allow them to feel no pressure at all into calling help to aid those if needed. In the history from Cynthia Martin, also from Lower Drinking Age Could Aid Terror Award, multiple factors between 1982 and present can account for the fall of drunken driving deaths, other than the increase of drinking age to 21 that year. The dramatic increase in seatbelt use probably accounts for most of the improvement. Greater public awareness efforts and strict zero-tolerance laws were also a major factor. The increase of the driving age may have been a small factor compared to these and other variables. So when we make an accommodation to lower the drinking age, we also make an accommodation for that group where it was once illegal. So it's not as if we only drop the drinking age only. We also accommodate those in that age group. Right now, the age group is being attacked by laws currently right now, such as don't get drinking or don't go buy alcohol. And when those who are found drinking under the age are often punished by the law. And if we continue to have this age group be excluded from alcohol, one, the safety will be concerned because you can't call for help. And then two, if they get into any accidents, it's usually, if it was 21 and higher, the support for that age group will be the same for 18 and 20. So in the end, you also reduce the binge drinking. So you sort of gradually lower the danger zone into a more early stage where they can adapt more easily.